Security Fire Department's hemorrhage control training props are kept inside this red jump kit and this red duffel bag. These two kits contain all the supplies you will need to conduct a hemorrhage control class. Inside the main compartment of the jump bag, you're going to find the overflow trays, the wound packing props, syringes, simulated blood. On the left-hand side pocket, we have practice tourniquets. Right-hand side pocket, we have bandage rolls and Kerlex. And then top inside pocket are for specialty bandages like Israeli bandages, quick clot combat bandages, and chest seals. Inside the red duffel bag, we will find class sign-up rosters, door signs, sheets and towels, gloves. In the left-hand side pocket, we'll find rags for dry practice and cleanup. In the right-hand side pocket, we'll find a mesh laundry bag, wet practice bandage rolls, and some tape. If you're doing a class for our community members or an affiliated agency, it's not a bad idea to use these door signs if you can't post someone at the main entry. You can place this sign on the outside main entry door. This one goes on the inner entry door. And then finally, this sign can go on the Deputy Chief and EMS Captain's office door to guide our visitors down to the classroom. At the beginning of class, please have all participants sign in on the Stop the Bleed sign-in sheet so certificates can be issued at the end of the class. When prepping the room for hemorrhage control training, we usually advise setting down some trash bags on top of table surfaces and then placing sheets on top of those to minimize the possibility of staining our tables. We generally put wound packing props inside the reusable trays to catch liquid overflow from the props. Room prep will also include removing a mannequin and the IV arms from the training closet for the tourniquet portion of the class. Please remember, we do not allow the placement of tourniquets on live persons for training purposes due to the increase in risk in tissue damage and injury from placing tourniquets. Kerlex bandage rolls, 4x4s, and quick clot bandages are included in the training kit so participants can do dry run wound packing practice with real-world materials. Once participants have had the opportunity to practice dry run wound packing techniques, the instructors can then assemble the provided syringes, fill them up with simulated blood, attach them to the wound packing props, and then provide the students with wet run practice. Please only use the recyclable linen bandage rolls or the white hand towels from the red duffel bag for wet run practice. The Kerlex, 4x4s, and quick clot bandages are for dry run practice only. That's where we want to concentrate our efforts. Good. Thumb over thumb. Or you can do finger over finger. Okay. Yeah, it doesn't really matter. It's just keeping that constant pressure on. Good. Oh, you got it right there. Keep going, though. I would just recommend keep packing, keep pressure on. All right, cool. Take the rest of your bandage now and just kind of put everything, over the top, and then keep that pressure on. Perfect, that was awesome. Yep, see, I can't even push down this. Recyclable bandages, towels, and sheets can be collected into the provided garbage bag for later laundry. At the conclusion of class, be sure to print off a completion certificate for all the participants. This can be done by logging into your instructor profile at stopthebleed.org, go to the instructor resources page, certificates, type in the relevant demographic information for each student, and then print. If you do not have an instructor profile, you can easily create one in just a few minutes. Bottles with simulated blood can be refilled by mixing red food coloring and water to the desired consistency. Please do not use any food coloring that contains sugar, corn syrup, or starch. Immediately following the conclusion of a class, please ensure that all the props and other supplies are cleaned thoroughly and restocked. Wound packing props, syringes, and the associated IV tubing need to be cleaned thoroughly with a mild detergent, rinsed clean with water, and then dried before being placed back into service. Linen from the class should also be cleaned as soon as possible with laundry detergent and a bit of bleach. Placing the reusable bandage strips in the mesh laundry bag that's been provided for washing and drying will help keep the strips from becoming a giant ball of knotted up bandages, which is terribly difficult to unravel. After the reusable bandage strips have been washed and dried, they need to be rolled back up and secured with a piece of tape. Now for this process, we are only using 2-inch cloth tape when securing the bandage rolls. Do not use plastic transport tape or any other type of tape for this procedure. Once the bandage roll has been secured down, please tab the open end of the tape over to ensure ease of removal for the next class. Now that all the props have been thoroughly cleaned, dried, and restocked, we're going to place them back into their assigned bags, place those bags back into the training supply room, and then this concludes our video. Thanks so much for watching.